I do wake up thinking about these things at both the community colleges and the universities. It's imperative we move forward in the fall, um, do so safely, emphasizing the health of all concerned, um, but to not lose focus on the fact that uh, our students cannot afford more downtime. I mean, there are growing disparities when students can't be in school. I think this is particularly true of the public schools, but it's also true of community colleges and the universities. I don't know whether you saw yesterday the national or the American Academy of Pediatrics had come out with the sort of guidance on this question um, that, again, particularly pertains to public schools and really early childhood education as well. But I think the broader, larger lessons are true for community colleges and universities. As you know, and I think you've probably seen the survey we've conducted of the 58, and we were still rounding up the last few responses. Our colleges have taken significant steps to be prepared for the fall. We've tried to support them here from the system office in terms of best practices and support in terms of funding for online tutoring, academic and career counseling, the small business centers, the rural broadband. We're going to spend, I think, around $10 million improving the rural broadband, given how many of our students are showing up in the parking lot, drive-in for the Wi-Fi, incredibly important, particularly for the satellite campuses. The work that we will unveil here later in July, to maintain our leadership in flexible learning, online platforms. I'm optimistic that nearly all of our colleges are well prepared for the fall. And we have one benefit that the universities don't in terms of the residential and dining facilities, because that adds a whole layer of complexity to this question that I'm learning more and more about. I'm very fortunate in my new role to be able to rely on Dr. Roper, given his vast expertise in public health, former director of the Center for Disease Control, former director of the Center for Medicare and Medicaid Services. I mean, you know how fortunate to have somebody with that background in the role. He has led the chancellors and their teams to undergo extensive preparations for the fall. I'm getting up to speed about that and feel as good as I can about our ability, both at the community colleges and the universities, to proceed, which of course will be done all along in accordance with federal, state, local public health authorities to make sure that our students, faculty, and staff are safe.